Hi, everybody. My name is Hussain, and I'm a USMLE Step 1 and USMLE Step 2 tutor with MedSchoolCoach. And today we'll be going through our question of the week, and it will be a USMLE Step 2 question. So let's get started. So I'll start by just reading through the question and then give you guys a second to think about it, and then we'll go through each answer choice and decide which one's right. So to get started, a 47-year-old man is brought to the emergency department due to a 1-hour history of sudden onset severe headache. He states that he was relaxing and watching TV at the onset of symptoms. He states that since the onset of the episode, he has been increasingly nauseous and has vomited several times. He denies any chest pain, palpitations, or shortness of breath. He smokes 1 pack of cigarettes per day for the past 25 years. He has a past medical history significant for hypertension and severe migraines that he states typically resolve with administration of sumatriptan. His blood pressure is currently 150/92, but vitals and physical exam are otherwise within normal limits. CT of the head is performed and shows no abnormalities. Which of the following is the best next step? So I'll go ahead and give you guys a second to pause the video here if you want to think through the answer and come to a conclusion on your own. Welcome back. I hope you had a chance to think about it and work through this question and come up with a solution. So we'll start just by going down the answer choices and seeing which one's right and why the others are wrong. And the first one says administer sumatriptan. So as we know, sumatriptan is going to be the treatment for migraine headache, and he specifically says that his severe migraines are typically resolved with sumatriptan. However, the only problem is that in this case, it doesn't seem like this is a migraine, given the history that's presented here. Given the 1-hour history of sudden onset severe headache, as well as his increase in nausea and vomiting, and he lacks the other characteristics of migraine headache that we would expect, such as photophobia or phonophobia. So with that, and with his other risk factors such as cigarette smoking and high blood pressure, it kind of points to a different diagnosis here. So we can rule that one out. B is administer 100% oxygen. So administering 100% oxygen is a treatment for cluster headache. And that would present very differently than the vignette that we see here. A vignette regarding cluster headache would present with signs and symptoms such as excessive lacrimation or rhinorrhea, so tearing, runny nose, and severe headache. One of the most painful headaches amongst tension migraine. It's usually the one with the most predominantly severe symptoms, and people are in excruciating pain. So while it is severe pain, he kind of lacks the other characteristics that we would expect for cluster headache, which are the rhinorrhea and lacrimation, which are very specific. So due to that, it's unlikely to be a cluster headache here. C is observe in the ED for 4 hours. So this is kind of the wakeful watching approach in terms of this answer choice, and that's not necessarily appropriate here because the pathology that this patient is kind of presenting with is too severe and something needs to be done right now. So D is order brain MRI of the brain. So the CT scan didn't show any abnormalities, but given his risk factors and the sudden onset severe headache, this patient is most likely presenting with a subarachnoid hemorrhage. And although the CT head didn't show abnormalities, the MRI brain can be used for sometimes in subarachnoid hemorrhage in case of like planning for surgical intervention and kind of identifying how best to go about surgical intervention. However, CT is more sensitive than MRI for diagnostics. And then furthermore, once CT is inconclusive, there's another first step that we need to take. And that will be our last answer choice, which is lumbar puncture. So lumbar puncture should be performed to rule out subarachnoid hemorrhage when there's a high clinical suspicion despite a negative CT head. And so what that means is that because this patient is presenting with characteristic signs and symptoms of subarachnoid hemorrhage, as well as having important risk factors such as smoking cigarettes and hypertension, it's very likely that he has subarachnoid hemorrhage. And so even though CT head is negative, we need to confirm that it's negative because of the deleterious consequences of not picking up a subarachnoid hemorrhage. So the next step we need to do is a lumbar puncture. The expected findings in lumbar puncture primarily the most important thing will be elevated red blood cells. So with that, let's get into an explanation here. So like I mentioned, the presentation of sudden onset severe headache can be associated with non-specific symptoms such as nausea and vomiting or impaired consciousness. These things should point you down the direction of subarachnoid hemorrhage. Remember to keep in mind the distinction between other chronic headaches that can present sometimes, such as migraine headaches, which would have more of the photophobia and phonophobia-like presentation, and not as severe of a presentation. And we have cluster headaches that would be as severe sometimes, however, would present with characteristic findings such as lacrimation and rhinorrhea. Also, keep an eye out for these risk factors that we mentioned, such as smoking cigarettes and hypertension, as they can also point you down the subarachnoid hemorrhage track. So the etiology of subarachnoid hemorrhage broadly can be characterized as traumatic versus non-traumatic. And so traumatic head trauma is the most common cause. So anyone who has head trauma can potentially lead to a traumatic subarachnoid hemorrhage. So make sure to keep that in differential. And the non-traumatic most commonly is caused by ruptured cerebral aneurysm. Other causes include Berry aneurysm, which are saccular aneurysms at the branch points of large arteries, and also AVM rupture. So diagnostics are, like we mentioned, an immediate CT, because that's going to be more sensitive than MRI to immediately pick up, also much faster, to immediately pick up subarachnoid hemorrhage. And then if that's negative, it depends on your index of clinical suspicion. So in vignettes, it will either be a pretty clear picture of subarachnoid hemorrhage, or it will be presenting as another kind of headache or something else. So if they present with a pretty clear picture of subarachnoid hemorrhage, and then say CT head is negative, the next step has to be lumbar puncture, because like we mentioned, that will be the next step to confirm the negative result on CT. And so the things that you're looking for are the high red blood cell count, so xanthochromia. You can also see findings such as high protein, and the opening pressure can be elevated or normal. So xanthochromia, in terms of definition, it just means a yellowish discoloration of CSF, and that's due to the presence of the yellow pigment that's from the breakdown of red blood cells. So just keep that in mind the next time you're doing questions and you see a person with severe headache, and just keep this on your differential and make sure you are able to differentiate it from the other signs and symptoms of different headaches. So I hope that was helpful, and that was our question of the week this week for USMLE Step 2 questions. Thank you.